All right, let's dive into a topic that, most of us will face eventually, but almost nobody wants to actually talk about hemorrhoids. Yeah, I know, it's a word that can make people a little uncomfortable, but hey, it's just a medical condition. And understanding it, that's the real key, not just for treating it, but for stopping it before it even starts.
I want you to think about this for a second. Get this. About 3 out of every 4 people, yeah, 3 out of 4 will experience hemorrhoid symptoms at some point in their lives. That's a staggering 75%. So if you've ever felt kind of embarrassed or like you're the only one dealing with this, just know you are absolutely not alone. You're actually in the vast majority. So when a problem is that common, it naturally raises some pretty big questions, right? Like, what are these things really? And why on earth do they happen so often? Well, that's exactly what we're going to break down. We'll get into the what, the why, and most importantly, how to get some relief.
Okay, first things first, what are we actually talking about when we say hemorrhoids? Let's get the basics down. Now, here's the first thing that might surprise you, and it totally changes how you think about this. Hemorrhoids aren't a disease. Seriously, they're a completely normal and even functional part of our bodies. Think of them like these little cushions of tissue and blood vessels that, believe it or not, actually help us with continence. So the problem isn't that we have them. The problem is when they get all swollen and inflamed. And it's not a one-size-fits-all deal either. It really comes down to location, location, location. You've got 2 main types. Internal ones are, well, inside, higher up in the anal canal. These guys usually don't hurt. Their big telltale sign is typically bleeding without any pain. Then you have external ones. They're lower down, covered by skin that has a ton of nerve endings, and those are the ones that can be really, really painful. Okay, so if these things are a totally normal part of our anatomy, why do they cause so much grief for so many people? Great question. And that brings us right to the causes and risks. Really, it all boils down to one simple thing: pressure. Too much pressure inside your abdomen. When that pressure builds up, it causes the veins in those little cushions to swell, kind of like overinflating a balloon. So what causes all that pressure? Well, things like straining on the toilet, the weight from pregnancy, or even lifting super heavy weights. And when you look at this list of common risk factors, you can see how they all connect back to that one core idea of pressure. I mean, chronic constipation or diarrhea, that leads to straining. A sedentary lifestyle, sitting all day, that can weaken the muscles that support everything down there. And a low-fiber diet, well, that's one of the biggest drivers of constipation to begin with. You see how it all connects? Understanding these risks is huge for prevention. All right, so we've covered the what and the why. Now for the big one. How do you even know if you have them? Let's talk about the signs and symptoms, and, importantly, when you should really go get things checked out. So here's what to look out for. Bright red blood, say on the toilet paper or in the ball, is a classic sign, especially for the internal kind. Pain, discomfort, itching, swelling, those tend to point more towards external ones. But listen, this part is absolutely crucial. While hemorrhoids are by far the most common cause of these symptoms, you can never, ever just assume. You've got to talk to a doctor about any kind of rectal bleeding, just to rule out anything more serious. Please. I think a lot of people put off going to the doctor because of embarrassment or fear of the unknown. But the truth is, getting a diagnosis is usually really straightforward. We're talking a simple visual and digital exam. That's it. Hopefully knowing that helps take some of the anxiety away, because getting that official diagnosis is the absolute fastest way to get on the path to relief and get that peace of mind. Which brings us to, let's be honest, the part you've probably been waiting for. What can you actually do about it? And the great news, really great news, is that there's a clear path to relief. It's like a hierarchy of treatment, and it all starts with some really simple, powerful lifestyle changes. So, the foundation for feeling better starts right here. And it all goes back to, you guessed it, reducing that pressure. Step 1, more fiber in your diet and way more water. This is non-negotiable. And here's a huge one for pretty much everyone these days. Get off your phone on the toilet. Seriously, that prolonged sitting and straining is a massive contributor. Beyond that, simple things like a warm sitz bath can feel amazing and give you some immediate relief. Now, let's say you try all those things and you're still struggling. Don't worry, you are not out of options, not even close. The next step is often a simple office-based procedure. One of the most common is called rubber band ligation.
It sounds a little weird, but it's super effective. A doctor places a tiny little rubber band around the base of an internal hemorrhoid, which just cuts off the blood flow, and it eventually just falls off. It's safe, it's not super expensive, and for a lot of people, it works wonders.
This chart right here tells a really powerful story about long-term results. Okay, look at that bar on the left. If you just stick with conservative management, diet, water, all that stuff, there's a more than 50% chance it'll come back within 5 years. More than half. Now look at the bar on the right for surgery. The recurrence rate drops to less than 10%. That's a huge difference. And it's why for those really severe, stubborn cases, surgery can offer a much more durable long-term fix.
So we've talked a lot about treatment, which is great. But you know what's even better than treatment? Not having to deal with the problem in the first place. So let's talk about prevention.
Does this list look a little familiar? It should. The keys to long-term prevention are the exact same things as the first-line treatments, and that's no accident. By making these habits part of your life, eating high-fiber foods, staying hydrated, getting active, and not straining, you're not just treating a problem. You're actively building a defense against it. You're taking control. And this quote really sums it all up perfectly. The whole goal of modern treatment is to prevent the problem from ever happening. The entire mindset has shifted. It's not about just reacting to flare-ups anymore. It's about being proactive and building a lifestyle that keeps your digestive system happy and avoids that root cause pressure. So it leaves us with a pretty interesting thought, doesn't it? For a problem that affects so many of us, isn't it amazing that the most powerful solution isn't some complex surgery or fancy medicine? It's the simple, everyday choices we make, what we eat, how much water we drink, how often we get up and move. The power is really in our hands. Thanks for listening.